Our granddaughter started preschool for the first time in September. Since then we have had a circulation of viruses, so that everyone is sick, and usually at the same time. As a master herbalist, I have dealt with some of these problems at home. I have also stepped aside when the answer didn't come from a plan. There have been several of those precautions. Some people can't use herbal remedies. None of us are in that category for the illnesses we've had, except our granddaughter. Using herbs on toddlers can be dangerous, so unless it was or is a normal food, no herbs. Those with medical conditions must contact their doctor or pharmacist before using herbs. Some herbs interact with both. Signs you need a doctor. As we are dealing with mostly respiratory illnesses at home, that's what I'm going to cover. How does the person's breathing sound? Grandbaby has had pneumonia 3 times due to this. We caught it early because we were listening for changes in her breathing. She will be seeing a specialist soon, as it isn't normal to develop pneumonia that frequently. Wheezing, gasping, or an unsteady inhalation or exhalation are signs you need a doctor. Is the patient coughing a lot? Is the cough productive? Anytime a person is coughing stuff up, it's time to be concerned. If what's coming up is white or green, it's time for the doctor, and maybe time for the emergency room. What's coming out the nose should also be considered. Clear isn't usually a problem. Anytime it's not clear, it's time to call the doctor. Severe sore throats, pain in the chest, high fevers, and headaches are also symptoms that may mean a trip is required. What to ask? How contagious is it? If there is a family member with a weakened immune system, they may need to steer clear of the sick ones. What signs should we look for that the problem is getting worse? What foods/drinks should be avoided or consumed is important. This is one of the most important questions. This is why I mentioned about our granddaughter. Is the pattern of illnesses unusual? Once the records were checked, the doctor agreed. Doctors don't have our medical information stored in their brains. It's unusual if they do. Sometimes even in the same practice, we may not see the same doctor each time we go in. This makes it imperative that we keep records and ask questions. They can verify and either agree or explain why it's not a problem.